I've been moved onto the main stage.
Welcome back for the last time today. It is lovely to see so many familiar faces from this morning back to learn more. And we return with one of the most difficult challenges the NHS is facing, capacity planning. For patient flow in a healthcare facility to run smoothly, it must be continually developed while keeping the patient experience a positive and easily accessible one. The technology emerging offers real-time patient locations and anticipated discharge data, and is critical to controlling peak demand, which allows the sector to allocate resources as needed to deliver high-quality care without waste and reduce the amount or pressure on the health services. Integrating technology that feeds back real-time patient locations, transfers information, capacity data, and anticipated discharge data is critical to controlling peak demand and minimizing the care backlog. So to join me exploring capacity data and planning that will better equip the sector to deal with the peak and lows of patient care pathways are Pritesh Mistry, Fellow Digital Technologist at the King's Fund, Jane Hayward, Programme Director for Elective and Networked Care, Hampshire and Isle of Wight Integrated Care System, and Professor Sudhesh Kumar, Non-Executive Director, OBE, NHS Digital. And do remember, this is your last opportunity to ask any questions that you may have of our panellists and help me make it an engaged conversation. So a very good afternoon to our three panelists. Lovely to see you all there waiting. I'd like to start by asking the same question, if that's okay. I'd like to find out what the pandemic was like for you and how it hastened the need to embrace digital technologies and transform patient pathways. Pritesh, perhaps you could kick us off.
Thanks. Great to be here today. So yeah, my experience of the pandemic, it was very difficult in lots of different ways. So I've got two young children. At the time of the pandemic, my youngest was probably around 4 months old. And so obviously there was all this pandemic happening and a lot of uncertainty. And then both my children were ill and there was a lot going on, but being able to access care in a way that worked for us, that we knew was safe and easily accessible was key, and digital enabled us to do that. Being able to move from voice to imagery, using stills, to then video, and then being able to switch back to voice again, really enabled us to kind of be able to communicate effectively with the clinicians that we were talking to and get the treatment that we needed. It didn't always work perfectly. So as my wife mentioned, it's sometimes easier just to talk to someone rather than fill out a digital online form. And so I think there is something that, yes, it can be beneficial, but it was also interesting to see the ways that which digital introduces new friction. I suppose there's this terminology that's used in the digital world, or new ways of different ways that it can become harder to access healthcare. And then equally, my mum, I've got an elderly mum as well, who took a tumble during the second lockdown, who's thankfully also okay. But then that also gave us an insight into some of the limitations. So there's stuff that does work really well on digital, some stuff that could work better. And there's also some bits that actually maybe it's not suitable to do digitally just yet. So I think there's still a long road ahead of getting this right, but there's also real glimmers of huge benefits for people who are, say, time poor or have different needs.
Gosh, Pritesh, that was lovely to have such a personal view of it, actually. Thank you for sharing that. Jane, do you want to pick up and give us a sense of what it was like for you and this sort of hastened need to embrace technology, what your experience was like?
I mean, it certainly was hastened, and I think that's what everybody saw. I mean, I can remember the first time I sat down with one of our CIOs and we played with Teams. And we honestly sat there and said, well, how do you think this works? Or what happens if you press this button or this button? And now I spend 10 hours a day on Teams, and just it is my natural second language. And we moved so quickly into that way of communicating, that way of meeting, that way of sharing information across the NHS. I really think that was hastened. But the other thing I think I saw is our clinical teams embracing technology. And I saw then our radiologists working from home because then they could review images. I saw our doctors actually running virtual clinics from home because actually they could get access to the EPR. So So all of those things are so important to allow the health service to continue to function. And we certainly saw a very big jump to either telephone consultations or video consultations. Predominantly, actually, the telephone. Video wasn't our main medium of communication with patients. It's just one step more complicated. But I personally had a whole course of physio, and it was brilliant. Brilliant. I was diagnosed by the doctor on the phone. I had a course of physio on Zoom. It was absolutely brilliant. And actually, I was incredibly well set up at my end. I've got 3 screens and a camera in a room, whereas actually my physio was trying to do it in her lounge and trying to demonstrate things between her settee and her coffee table with plug-in headphones. And those plug-in headphones really disabled her. So I'm sitting here with my AirPods thinking, well, I haven't got that. So actually, I've been back and said, just those really basic things about home working make a real difference. And then once she's unplugged, she can do all the demonstrations, and it was great. So those small things make a difference. But if we're going to work remotely, we need to get the environment right for people. I think that's my point.
Just briefly, before we move to Sudhesh, I'm just intrigued. How does physio work on? Because the physio I've always had has been like hands-on. Are you doing it to yourself, if you like?
Yeah. So she was demonstrating the exercises. She was looking at my range of mobility, and then could demonstrate what to do to improve my range. So I had a bad shoulder, so and it worked incredibly well for me.
That's amazing. Sudesh, what was the pandemic like for you? And is some of this music to your ears as a non-exec director at NHS Digital?
Yeah, so just to follow on from Jane, I think there are avatars that can help you do physios as well. Yes, I'm not quite sure which hat to start with. So let me start with my role in the hospital, University Hospital Coventry. That's where the first patient got the COVID shot, if you saw it. So I got an opportunity to see firsthand how things changed very rapidly, and they had to move out very quickly out of necessity. And some of the things I've been banging on for years, things like, why do you call young diabetic children all the way to hospital for a routine review, etc. They miss a day of school, they miss the parents, lose time. And literally, there's no need to say it anymore because people are doing it. So remote consultation suddenly, got enabled. I've heard a statistic that in the West Midlands alone, patients travel 13 million miles a year to go to their various health appointments. So it must be good for the planet, and saving the patient lots of and their families a lot of hassle and time. The other thing is, of course, a couple of people mentioned Teams. Of course, that's wonderful. Yesterday, I read a statistic that NHS has saved 2.9 million hours of time. I'm not quite sure where that's getting spent now, but we apparently have to save that.
You've got that in the bank somewhere.
Yes. And I think not just remote consultation, but flexible working practices for staff, which has really been helpful. So whereas previously it would have prevented, I'm hoping this can mean that some of the staff who may have decided to cut down the hours or retire maybe because of family commitments, etc., may now be enabled to contribute, and we desperately need more workforce. If I look at my NHS digital hat, it is a really exciting year, the last year, because the entire, both the pandemic response, whether it's the vaccination program, or dealing with, like, say, the current elective, issues. One thing that happened that is different, it's much harder to get a national platform going for anything. People sit and argue for ages around, but all of a sudden at pace, the national vaccination program, the NHS app again ramped up quite rapidly, so a number of things that we have sat back and dithered with for a long time suddenly started moving at pace. Finally, my day job is actually, I'm Dean of Medicine at University of Warwick. That was incredibly hard, and at the university sector. But again, I was quite pleased how staff responded by, coming up with really creative innovations for training staff in challenging circumstances, staff and students, and doing it safely. So a lot more. Now we won't go back. We will always do a lot of these things. We'll carry on with them.
Pritesh, we heard about Jane's physio experience. Can you give us some examples, sort of in layman's terms, about the tools and what they've been used for in ways that we as patients would understand? So I'm thinking of things like I can't even say it, endoscopy in the home, and things, you know, like the physio that I couldn't have imagined happening remotely.
Yeah, so just building on the physio point, so the NHS before the pandemic was, I think in Lancashire, was trialling a VR system, so virtual reality for rehab. So you'd like, similar to, as Sudhesh mentioned, you would see an avatar that would also track your motion. So you'd have something that would basically you'd wear, and it'd be able to track how you move in your hands and your limitations of your mobility, and be able to measure your heart rate and track your vital statistics. And then on the back end, you've got a clinical person who'll be able to be aware of any distress and make sure that everything's clinically safe. But then you can access rehab in a way that works for you in your home, as opposed to having to travel to a class. And some of this predominantly was initially around pulmonary rehab, and there's low levels of adherence due to classes being further away from patients and having to take time out of work and all these other things that come into the picture. And so being able to access care and treatment in your home around your personal constraints is something that's truly unique about digital. So the endoscopy capsule is also something that's been developed within the NHS that, again, it allows a patient to be able to have a scan effectively of their internal organs, the intestines, really. They can swallow a pill, they wear a belt, and that captures the images from the pill, and then that's sent off to a surgeon automatically, a clinician automatically, who can also then give you a diagnosis, all remotely. You have to pick up the kit, obviously, from a surgery, but it's all there in the home for you to be able to do in a way that works for you, can improve your privacy and other such aspects. So there's a lot of uniquely digital benefits that we can add into the system that can improve the overall services. So as Sudhesh mentioned around travel, again, so online consultation seems quite new to the NHS, but quite old in terms of like consumer technology. It can really help people who have trouble getting transport, or for routine appointments that people can fit into their day much more easier. So there's a lot of benefits that come from digital. It's just making sure that they work for people in the right way.
Yeah, and as Sudhesh says, hopefully here to stay and to build on, because we're building on, aren't we, I guess, the learnings that were made during the pandemic. Jane, you're in Hampshire and on the Isle of Wight. I only discovered the Isle of Wight last year. What a beautiful place. It was absolutely gorgeous. And I just wondered what you've done to deliver high levels of advice and guidance, sort of changing that relationship, you know, between patient to doctor or doctor to doctor.
So no, thank you for that. So we started our work in Portsmouth, and we've been rolling out from the Portsmouth system across the rest of the Hampshire and Isle of Wight, and are now hitting very high levels of advice and guidance. We're now 40% in Portsmouth. So of our GP to hospital consultations are going through our advice and guidance service. So that is clinician to clinician. What we're seeing is a phenomenal change in our waiting times. So for some of our urology services now, it's 10 to 14 days to first new appointment. It's just absolutely transformed the service that patients are getting. It was a journey that started pre-COVID, but accelerated through COVID, as you can imagine, but does require quite a lot of work on all sides. We've personally decided we're going to stick with the ERS system. So we use the electronic referral system as the basis for our advice and guidance. For us, we didn't want to put another platform in. We didn't want to create another tool for people to use. And we're also working with the national team to help them support to get ERS to be as functional as it could and should be, because I think we all know it isn't the best platform at the moment. But there's a lot of money going to go into it. And a bit like the NHS app, I think it will really come on. So that involves the GPs working differently, because all of our referrals are now performer based. A lot of the patients need pre-testing before they come in and get their advice and guidance. But it's taken a lot of cooperation to get that work running across Hampshire and Isle of Wight. We're still on a journey. we've still got lots of doctors to convince, and we're almost having to do it doctor by doctor.
Really?
Yeah, doctor by doctor, and actually CIO by CIO, because again, the technology isn't quite as they'd want it to be. But we absolutely recognise this has changed the waiting times for our patients, and that's what we're all about, isn't it? Is how do we do that, but make sure at the same time our clinicians change their job plans, because this isn't extra to their job plans. This is instead of doing an outpatient clinic, isn't it? So we have to make sure we've got the job plans right, and the clinics right, and the digital right, and the culture right. And I think that's how you get success.
A couple of quick questions coming in. First one to you, Jane. Actually, it says, have you or your colleagues experienced any deterioration of eyesight, backache, weight gain in the last 18 months? And I guess that's formed on the basis of us being, you said at the beginning, you're on Teams 10 hours a day now.
Well, yes, probably to all those things personally, and so it is a real issue, isn't it? It's such a change in people's working culture, and I think we have to really think about how we do this. We leapt as an NHS, didn't we, to home working, and I mean I heard stories of people working off their ironing boards, because that was the only flat space in their house. And they lived in, a house with their 2 children, and there weren't any spare bedrooms, and there weren't any spare downstairs rooms, particularly in open plan living, which people like. And suddenly we asked them to make a home office. It wasn't reasonable. Lots of other people actually just went into their home office and closed the door and said, I'm set up. To go back again and say, actually, if you're home working, how do we get you a desk, a proper chair, a proper piece of kit that is an eye line, etc.? Because otherwise we will have a chronic list of injuries, and it isn't right for people. People did it in a panic. They did it in COVID, but now we're trying to go back and make sure we've done that health and safety review on everybody's home working environment.
It leads me nicely to Sudhesh. And how well prepared is the NHS, do you think, Sudhesh, for digital transformation? I mean, we don't want to be on our ironing boards. Mind you, I don't use mine for anything else. So that would be fine in my house.
Yeah, that's a good question, because clearly there is massive opportunity with technology to get the productivity we need, to get the access for citizens we need, etc. But and historically, the UK has been pretty good with general practice, electronic patient records and things. So they're a little bit further ahead in implement. The hospital sector has been, and mental health trusts, they have been way behind. I mean, it's very patchy, and majority are still have a long way to go to get a decent system. The other problem is they need lots of investment in the actual systems itself. When you had the cyber security issue with WannaCry, for example, it is surprising that in this day and age there were lots of trusts in the UK that was vulnerable, because they're still running Windows XP and so on. So I think we need the investment in the infrastructure. The second aspect is around people. I mean, majority of the people are still bewildered by technology, and they haven't had certainly. When I went to medical school, I never got taught, how to use technology in my day-to-day practice, etc. So we really need a lot of effort on training our staff, existing staff and new staff. So in our medical school, for example, I introduced a module on the digital doctor for medical students, but that's not something that gets taught or introduced to medical professionals when they're in medical school. Ditto during their postgraduate training. But this will take time. But I think there are lots of initiatives such as the NHS Digital Academy, Topol fellowships, and etc. But I think it'll take a number of years for at least for staff to get up to it. Now, people have learned how to use Teams, so that's a start. But I think there's one of the challenges we have in terms of the access that Pritesh mentioned is if you do piecemeal patching up of use of technology in parts of the pathway, what will happen is it's still frustrating for the patient. When you start on a pathway, you can do part of it, but then you're stuck at the next stage because they're not connecting with this bit or whatever. So I think it's trying to think about how you digitize and make a whole pathway work end to end. That's complex because often it works across multiple organizations, etc. And so it'll take time.
Of course, I think it will take time. I think with Gen Z, it'll all become easier as well, won't it? I mean, I'm just thinking of my children in that they've been born in the digital age, so that they would expect everything to be digital, where at the minute we're still, helping staff and patients alike adapt to it. Pritesh, I just wondered, what are the national policy drivers and enablers for digital transformation, do you think?
Yeah, good question. So I suppose the big thing that's going through right now is the integrated care system. So England's going to be divided up into 42 areas responsible for the coordination, planning and strategy of health and care services for those populations. And the Health and Care Bill, I'm sure you've all heard about, is going through the process of becoming official legislation. So under that bill, there's going to be a lot around integrating services, as kind of Sudhesh mentioned, and digital needs to be a key underpinning of that. And to try and support that to happen, the Health and Care Bill is creating a duty to share information. So as Sudhesh mentioned, it's not just about having digital in places, but it's the end-to-end digital, the ability for information to flow from clinical team to clinical team and have the patient involved as well. And so the Health and Care Bill hopefully will support that, not just in the NHS, but across the NHS, private providers, and social care, both public and private. So that will hopefully help patients who move between public and private paid services. But also the aim is to have standardized data standards across the UK. So patients close to borders, patients who may have an injury or an illness while traveling, whether for business or for pleasure, will hopefully have a joined up service of care, because that data will be able to flow and systems will be able to talk to each other. This is then also supported through the procurement of digital, which should be adhered to these standards. It will take time for that to filter through into the system, but hopefully that will be a huge driver towards sharing of information, opening access of data, which will be pooled. So the ICSs will also have centralized analysts that will allow data to be used for service development, service design, be able to understand which populations need more support, how to tailor services better for particular populations, reduce inequalities. So these are huge drivers around digital that can contribute to improving how services are delivered for people.
I'm just going to read Ilya's question, Pritesh. I think you've probably just answered this actually, but I'll read it just in case there's any other point in there, because I see these questions for the first time as you do. Ilya said, how do you see clinical communication working in ICSs between different trusts and organisations that all use their own systems, EPRs, etc.? A patient who has to go through multiple levels of care, counsel, primary, secondary, etc. I mean, I think you've pretty much answered that there, but is there anything else you wanted to add to that?
So I think just to add, it's a new epoch in a way. So ICS's integrated care systems, there's a lot of the systems are siloed. A lot of the ways of working are siloed. Patients have to do a lot of translating between services and try and join up the service for themselves. Hopefully, with the Health and Care Bill, with the new technologies, with the standards coming through, that will become a lot easier for patients. There's still a lot that needs to happen in how we communicate with patients, but we're moving in the right direction. It will take time. I suppose the other thing to add is that there is the patient records, the GP records, should be open to access for patients in between December this year, depending on which systems the GP uses. So December this year through to, I think, March next year. Sudhesh will probably be able to give you the exact dates, but so that there is an intention and capability, increasing capability to improve access to this information, both across care teams and with the patient.
I know, Jane, you've done some work on patient-held records and to support the management of people with long-term conditions, particularly those with cancer. Do you want to tell us about what you've been doing in that area?
No, thank you. I mean, it very much links to what we've just talked about. Is about how do you connect up all of the information for the patient, but also for the clinician. So I think just to tell you the Hampshire and Isle of Wight experience for our clinical teams, at the moment we're working on single authentication. So all of our systems will know who all of our staff are across all of our trusts. We're starting to work on a single master patient index so that we know who all the patients are. You'd be amazed how much patient identification is a big thing. And then we're going to work on a single scheduling system to try and replace our PAS systems over time. So we see that single way of working coming, but it is a journey. What we've got in the meantime, I suppose, is two things. For our clinicians, we have our shared care record, so that gathers information together so clinicians can see information from different sources, be it primary or secondary. For our patients, we have My Medical Record. So I've got a My Medical record. I can see all my secondary care information in there at the moment. And in there, I can see my appointments, I can see my letters, I can see my medications. I can also, if I've got a patient with a long-term condition, I can start to get into a clinical communication with my team, because we use My Medical Record for lots of different things, but a lot of that is to create that patient-initiated follow-up and to discharge people from formal clinic. But you're still in the system. So for us, we've got patients here on cancer pathways. So particularly our prostate patients, they know they need a PSA test. The PSA test is booked for them. And actually quite often by the time they're home from their PSA test or the next day, they can see their own results. The clinical team will also see their results, but they can see them as well. And what we start to create is that educated and informed patient group, who then actually, if their levels are raised, will start to message the clinical team. It has to be that digital relationship with the patient. I get that from every other industry I interact with now. And we have to create that digital relationship for the digital natives, for the people like me, and actually for my parents who are just about getting to grips with this now, because we've made them practice through COVID, haven't we? So My Medical Record really works for us. We've got over 100,000 patients registered now across 14 trusts because it's a national system. But it is about giving the information to the patient. So at least the patient can see it first or convey it to another health professional if they need to.
Absolutely. And just following on from that, Jane, Jim says the biggest digital move that will transform patients is communications. That requires an ability to message clinical teams and be informed digitally rather than by paper. How open are clinicians in the UK to proactive requests from patients? I just wondered how open your clinicians had been.
So we've had to work through it very carefully. And that for us was about red flag symptoms. So we had to have a system that if somebody's messaged us and they've got urgent care needs or red flag symptoms, that somebody's going to see that message in, if not real time, in soon time. So we've had to work through those processes. It has to be in a system. What we couldn't end up with is patients texting our clinicians on their phones or leaving messages on answer phones.
Yeah.
So a lot of that is nurse-led. The nurses are looking at those messages first. They're filtering. But I think people find it is useful. And actually, particularly for those long-term conditions, what they found is often patients would wait too long. So we looked at it particularly in our IBD service. Patients would have a flare, but they knew they had an appointment in 3 weeks' time, so they'd wait for their appointment. Well, actually, when they needed to change their meds was at the time when they're unwell. So it's supporting patients at the time they need, which means they don't come for those routine appointments with lots of nodding and smiling and saying, well, there's nothing to do today, is there? So I think the clinicians have got used to it, but they are worried about what happens if it's open access.
Yeah.
And that's where we just have to do this carefully and slowly, don't we?
We do. And the other aspect we have to consider, Sudhesh, I suppose, is how can we reassure the public and patients about confidentiality and privacy?
Absolutely right. And I think just to follow on from those excellent comments from Pritesh and Jane, there are myriad ways of tackling this problem, because from a practical point of view, for a professional trying to look after, say, for example, a patient with a frail elderly patient with multiple comorbidities, they will probably have to interact with lots of professionals across many organizations. And each one, you can either have a system where they all agree to have the same kind of record, electronic patient record, etc. Hard, the way they think. Or you need some way in which the data layer is separated out and you can share the data. And an essential part of that is the patient being in it. Now, there is research going on that. For example, in my institution, there's one on a cloud-based platform where professionals and the patients can also share. You can actually control what bits of data that, what bits are seen by the patient, because if there's very technical or whatever, then maybe, but I think there are, so the technology is there and it's possible. So I think that will be the next. You need a mindset shift as well from clinicians, etc. So, but I think patients want it and want to be involved. And there are some very good examples. Let me give you an example of access to A&E, for example. NHS, so we have the 111 system. It runs on a clinical decision support system, basically an advice engine. That same thing is now being deployed. It's being rolled out now in the A&Es into a streaming and redirection product. But the interesting thing about that is it's a patient who does their own triaging. So they're given an iPad, and they can actually answer simple questions. So it's the same sort of thing that a person at the end of 111 might do, but they can then work out, I don't need to be in A&E, I need to go and see an optician. And if they did that before they turned up in A&E, it'll reduce the pressure to, because we have a problem with 4-hour waits in A&E generally in the country. So I think these are examples where patients can be part of, if you like, solving these problems with access and that kind.
I'd love to end, Pritesh, on a bit of community involvement examples. I'm just wondering how we can build on the community involvement that we've seen, for example, with the vaccine rollout plans. So, we've seen vaccines in mosques and supermarkets, and the communities felt very involved. Can we build on that as we move ahead?
I think it's absolutely essential that we do. I think that the work that we've done in the healthcare system to reach out to people to ensure that the vaccine rollout was very successful is a great asset to build on. As you kind of mentioned, there's a lot of work being done with community groups and in places that usually you wouldn't see the healthcare system having a presence. And there's a lot of new networks and relationships that have been built that can continue to grow, and the trust can grow. And how do we work with these people to make sure that the systems and the services work for them? And the future is an involved community that shape the services to work in a way that works for them, to reduce the overall inequalities within the communities and make sure the service has good experience and good outcomes. So I think that the relationships, the trust that's being built is a huge opportunity that should be built on for digital transformation.
Just final word from Jane and Sudhesh. I feel that really digital's been default, hasn't it, by default in a way in the pandemic, or certainly as we started off this conversation by saying it's been hastened. Are we feeling that digital and a mix of personal is the way forward? Jane, do you just want to give your thoughts first, and then we'll end with Sudhesh?
I think absolutely. I think we're on a one-way journey now, aren't they? I as a customer demand that now, and that's the NHS I'm going to expect of the future. And so I think as I move into my older years, I will expect the NHS to be a digital NHS, not the one that my parents have experienced in the past. So.
You've got plenty of time to go, Jane. Sudhesh, no pressure. Final word of the event to you.
Thank you. So I think it's going to be digital augmented, healthcare in the future, and we'll all embrace technology in improving services, etc. And we are definitely not going back. I think going forward, I think it's about better productivity, better access, and more platforms that are easily accessible for patients and staff amongst themselves. So it's a new world. I think the challenge for us is we need more better infrastructure, and that's something that needs investment. We need better training of our staff so they can embrace these technologies. And it's been said by somebody else that medicine has been one of the possibly the second slowest in adoption of technology in its day-to-day processes. So I think it's a chance to rectify that and actually, make sure that it's part of it. But one area that does need attention is digital may not be the solution for everything. Yeah. And there are times when, and we still have some things to learn. Like, for example, it needs evaluation, digital consultations. How well does it perform? Are we missing something? Then there's potential for health inequalities. An elderly person who's harder for their hearing. So we do need, those things need working through. But that I think is something. That's where I think what your comment about the mix comes in, because we need good judgment in working out, where that may not be the best solution.
Sitting from my side of the table, which is certainly on the patient side, it's been, I think, an impressive NHS in lots of ways, not just dealing with, obviously, coping with the pandemic and everything that's brought, but I think it's been a very impressive digital transformation so far. And yes, of course, there's things to iron out and training and to get the balance right between personal contact and digital contact. But I think it's quite exciting times, and it'd be interesting to be having these conversations in a year's time, because it really has been all hands to the pump over the last 18 months. And now there's time to sort of assess, isn't there, and take the best learnings from what's gone really well, and also learn from what patients haven't liked or what clinicians haven't liked. So fantastic end to the day. It's been fascinating to talk to all of you. Thank you very much to my panelists for a fifth and final interesting debate. And with that, we draw to a close on what's been a great day of guests and delegates networking across our NHE365 platform. We've covered a breadth of challenges, opportunities and solutions as we've engaged with the topic of digital healthcare. I'd like to thank all of our speakers and panelists today who've taken the time out to share their expertise and insights. And as mentioned throughout, all of today's content will be available to view on demand within the platform at your leisure within the next 24 to 48 hours. And remember, our networking tools remain open year-round with an ever-growing community of registered innovators, including you. I'd like to thank you, our audience, too, for taking the time to listen and learn and for taking part in our discussions today. If you're a winner in our gamification challenge, then the NHE team will be in touch to discuss your prize options. Separate to gamification, today's event was CPD certified, so 1 CPD point earned for every hour of live content you watched. We'll collate this information, but in order to receive your certificate, just send an email to marketingandevents@cognitivepublishing.com. And once we receive these emails, we can distribute the CPD certificates. Before we go, I'd like to extend a special thank you to our events team behind the scenes at National Health Executive, who have helped put this event together and have worked tirelessly. And from me and everyone at NHE365, thank you for attending today and giving us your time and attention. Have a great rest of the day. I'll see you again, hopefully at our next event, NHS Estates, which is taking place on December the 16th. Perhaps this time invite some of your colleagues too. Be good to see you. Bye for now.